Are we trending down when it comes to coronavirus in North Alabama? Health experts say that may be the case. Today, Crestwood Medical Center CEO said they're now seeing the lowest number of hospitalized patients since the outbreak started, and we're in the containment phase. Joining us tonight is the CEO of Crestwood, Dr. Pam Hudson. Thanks for joining us.
Well, it's great to be here, Dan.
So explain to us exactly what a containment phase is and where it falls on the timeline for getting things back to normal, for a lack of a better term.
A great question. The containment phase really is it's part of the ongoing process with an active infection, but the initial stage is mitigation. You want to try to stop and slow the first wave of infection through a community, and you do that by, at least in the coronavirus, hand hygiene, physical distancing, stay home if you're ill, seek care, masking, that sort of thing. Mm-hmm. When you are successful in flattening the curve, as I know you have heard many times, is to try to stretch out the number of infections so that you don't overwhelm the infrastructure of your healthcare system. Then you can go into a containment phase. And we're already in that. It isn't a sharp demarcation. It just sort of flows in. And that's where the number of infections are not overwhelming, and you have an opportunity to identify people who have it or may have it, and other high-risk, very high-risk individuals, and test them. And if they're positive, you contain them, you quarantine them, you do contact tracing so that you actually are trying to cut off the virus's spread from a particular source. And that's why the great focus on testing. You need to be able to, when you have a patient or someone who is ill showing symptoms of the virus, you need to be able to test, find out fairly quickly, and then take the action to isolate, separate them from others who they can infect.
So what are the next steps for the community? Is it just a lot more testing?
I think you will see testing continue in people who are ill. And we do in this community have pretty good availability of tests, and we're all starting to get the more rapid turnaround tests. It's not as helpful when it takes 5 to 7 days to get a test back. The person has to self-isolate, and they're not able to do the contact tracing that you can if you're tested this morning, you find out this afternoon, you've got somebody on the phone with you asking you about who you might have contacted and who else they need to talk with to try to contain the outbreak. So the testing, and especially the fast turnaround testing, is really critical for this phase. Yeah,
and in terms of your facility, what are the next steps for hospitals?
Well, hospitals are moving from the phase where we, I guess, for lack of a better way to describe it, we kind of drop a number of things that are our normal work that we do in the community in healthcare, and we focus on being ready to take care of a surge of very sick people as the virus goes through the community for the first time. So we're through that, and our next phase is what I'm calling a dual mandate. First, we have to be able to take care of our community by helping to contain and care for the people who are sick with the coronavirus. And then secondly, figure out how to get back to the business at hand of all the other healthcare needs of the community, because other illnesses don't stop just because we might be distracted for a period of time with coronavirus. So the hospitals have to be very safe for people who aren't infected, and also has to be very sure and swift in the care we're able to provide those who do get infected.
Yeah. Now the current health order expires at the end of the month. Do you think is it safe to reopen at the beginning of May, or what's your advice for leaders making those decisions?
Well, I think that the consensus seems to be in communities such as ours, where we really have a relatively low risk compared to other parts of the state and other parts of the country, is that if all those indicators continue a decline in cases and mitigation strategies were successful, that you can then begin to get back to work. Now, you don't want to just blow a whistle and send everybody back on the same day. We count on our business leaders and other community leaders to do a phased-in approach with some care towards making sure that in the workplace that we can have physical distancing, we can do masking, universal source masking, and have a way to keep people away from each other, and then certainly reinforcing the personal responsibilities. For goodness sakes, don't go to work sick, and taking care of yourself. So I'm confident that our community can do just as good a job at that as we have with the mitigation phase, and I know that you can't stay separate forever. We do have to move on, and I believe our community is as ready as we can be for this. But it's ultimately up to the state health officer and the governor and other local officials in terms of exactly how that'll happen. And hospitals and medical professionals are standing by, ready to help. Certainly we will see more cases. The goal is to not have those cases overwhelm and distract us from the business of taking care of all of our community.
Really encouraging words. Dr. Hudson, thanks for joining us. Appreciate all you're doing on the front lines of this.
Brett, thank you very much, Dan.
Take care.